For Proficiency 33 for managing an oropharyngeal airway, you're going to start with first putting your PPE on, so your gloves, mask, whatever else you need, and then you're going to establish consciousness using the AFPOOP scale. So if the patient is conscious, you don't want to do an oropharyngeal airway on them because it'll just cause them to gag, which defeats the purpose. But if they are unconscious, you can do an oropharyngeal airway to manage their airway. So first you're going to check their ABCs, so check their airway by making sure there's nothing blocking it. Check their breathing by listening, feeling to their chest, and then check their circulation by taking their pulse and or taking their blood pressure. So after that, then you're going to position yourself behind the patient's head, and you're going to determine, but prior to this, you would have already determined if the patient was suspected of like a head or neck injury, because if they do have a head or neck injury or suspected one, you're going to do the jaw thrust maneuver to open the airway, because it keeps the spine in neutral position and it won't further compromise anything. But if the patient doesn't have a suspected head or neck injury, then you can just do the regular head tilt chin lift maneuver to open the airway. So after that, then you're going to measure what type of or what size of oropharyngeal airway that you need. So you're going to do that by measuring from the incisors all the way to the angle of the jaw. Then it's obviously going to vary in size between like an infant to an adult, so you have to make sure that it fits the right way so that it does what you want it to do. So then you're going to take your oropharyngeal airway and you're going to put the hook side down facing the tongue, and then you're going to keep inserting it back until it goes past the soft palate, and then you're going to rotate it 180 degrees so that that curved part is now facing up towards what would have been like the hard palate, or towards the roof of the mouth, sorry. And then after that, you are going to make sure that you insert it correctly. So you can do that by listening and feeling and looking at their breathing. Basically, the way that it works is that it's pushing down on your tongue and keeping it out of the way of the throat so that the patient is still able to breathe and their tongue isn't falling back into their throat, causing them to choke. So